There's no way to figure out what's going on if we don't touch your body, manipulate things, and actually try to reproduce your pain through your own individual movements or through our moving you. Injection techniques are oftentimes used specifically for diagnosis rather than therapeutic. Our treatment focus is mostly on education, your posture, your behavior, in other words, what you do and how you do it all day, every day. Those are the most important things. Those are the factors that drive pain of spinal origin. Exercise is prescribed to support modification of posture and behavior. We always strive to employ the least invasive method possible. Invasive techniques oftentimes are necessary. We want to make sure they're used only when appropriate, but that they are used when they should be used. Conservative emphasis again, non-invasive treatment when appropriate. We want to educate you, help you understand your problem so you can manage it on your own, needing our help less often. And oftentimes when you go to therapy, it will be simply too uncomfortable to tolerate. Some of you may have experienced that before, where you simply can't get through the therapeutic process because it hurts. In which case, injections can really facilitate that process, as can surgery. If you're severely disabled from your pain, you're taking a lot of narcotics to control it. You can't go to work. You can't take care of your house, your family, or your loved ones. At that point, it would be silly to say, just go do a month of therapy. We're not going to do that to you. We're going to try to get you better so you can live your life while you're getting through the other processes. So again, our emphasis is conservative. We want to get you better non-invasively, if at all possible. We focus on posture and behavior because these are the things that allow you to continue to feel better even when you're done with your treatment.
Back or neck pain, it is prevalent for everyone. It's so bad that it is considered normal. You're going to have episodes where it's worse, but you can manage this pain independently yourself. Surgical practice has found out that these particular areas are the main producers of your pain. Number one is that nerve root. Number two would be the intervertebral disc, posterior longitudinal ligament. A lot of nerves in those areas. These areas that Dr. Michaels had talked about earlier, facet joint pain, sacroiliac joint pain, all those areas are pain producers. And we know that, and we know how to address that. Posture. I cannot tell you how much we look at your posture because of that effect I said earlier of those couple of slides. You sit in bad posture, doesn't matter how good your back is, it will become a bad back. Repetitive movement, movement loss. It's one thing about bending forward or bending backwards one time, but what happens if you do it over and over again? And that's what most of us do during the course of the day. Special testing, there are certain things that we're going to look at that might allow us to make a more definitive diagnosis. As Dr. Michael said before, differential diagnosis. Why do we think it's this versus that? It is going to make a difference between what we do with you. If there is a situation that we don't believe would be progressed with physical therapy, some of our people make great progress after they see Dr. Michaels with an injection. It actually can make your course of therapy much quicker.